I was diagnosed with colorectal cancer, and it was approximately 7 months ago. So it was a complete surprise, and it was shocking. I was just really scared and wondering if I'm gonna die.
7 months ago, I was diagnosed with rectal cancer, and now it has ran to my anus. The only thing I can do is just keep going forward.
I was diagnosed about 2 months ago with anal cancer. Truthfully, I was in shock. I never thought I'd get cancer. You just never think it's going to happen to you.
Cancer is when your body's cells start multiplying uncontrollably and they crowd out your normal cells. When cells divide uncontrollably, they can oftentimes collect together and form masses, which we call tumors. The role radiation plays in treating or curing cancer is that it can kill the cancer cells. Radiation is just like an X-ray. The difference is the energy of the X-ray is strong enough to penetrate through the body and cause direct damage to the DNA in the cancer cells. And then they die because they're not able to repair that DNA damage. Healthy tissue is also exposed to radiation therapy. The difference is that healthy tissue is able to repair any DNA damage that it sustains, while the cancer cells cannot. Lower GI cancers include colorectal cancers and anal cancers, both of which can be treated with radiation therapy. In colorectal cancers, radiation therapy is often used prior to surgery to help shrink the tumors and get rid of microscopic disease in the area. In anal cancers, radiation therapy is the primary treatment to kill the cancer together with chemotherapy. Yeah. Chemotherapy makes radiation stronger, and it's not just a simple 1 + 1 = 2. It can be 1 + 1 = 3. So it really makes the radiation more effective tool at killing the cancer.
I have this information for you. This is a little pamphlet from Astro. For their first appointment, patients should expect to be seeing a radiation oncologist and a nurse. They will not get treatment, they will get options. Patient education is important for patients and family because it helps them make informed decisions.
Educating myself has reduced my stress a lot, because I do have anxiety.
When's the appointment with the surgeon? Do you know yet?
We highly recommend patients to come with a family member or a friend for their first consultation with a radiation oncologist. We want them to have that support, to ask the doctors questions and to take notes.
We'll push you through a few times, scan you, it'll be a few minutes.
The first step after your consultation is a CT simulation, also known as your planning session. At this session, we put you in the position you'd be in for your treatment, and we create immobilization devices.
Immobilization devices are used to make sure that there is accurate positioning and repositioning for patients from treatment to treatment. CT simulation is a process where the therapy team can locate the exact size, shape, and location of the tumor so they can take images for planning purposes.
We take a scan of your body in that position, and that scan is imported to my treatment planning software. On the day of simulation, you may have an IV placed, which is used to give contrast so the radiation oncologist is able to identify regions that they may want to target.
You're going to feel a little pinch, okay?
At simulation, marks are often placed on the patient, which are then aligned to lasers that sit in the walls on treatment delivery days.
The tattoos are very small, like a freckle, and you can almost not see it.
Sorry for any discomfort.
The radiation oncologist or therapist may enter and place a marker at your anus to help identify the lower extent of your GI tract.
The pre-treatment planning was very easy, and the scary part's pretty much over.
After simulation, we take the images from your CAT scan and we use it for treatment planning. This is called dosimetry. The radiation oncologist works with the dosimetrist and physicist to come up with your radiation plan.
As a dosimetrist, my role is to perform calculations and treatment plans for each patient. It's under the guidance of the radiation oncologist and the supervision of the physicist. Dosimetrists are highly trained in the placement of beams and how to target the tumor and avoid normal structures and organs that don't need to be treated.
The radiation oncologist, together with the dosimetrist, will draw the areas we want to treat with radiation and the areas we want to avoid with radiation. We then use those drawings to aim how we're going to target the radiation specific to your anatomy.
We are able to attack the tumor from multiple directions by using different beam angles and angling the table.
The radiation therapy plans are highly individualized to your anatomy and are very precise.
The physician will look at the plan and approve it. Once that is complete, then our physicist checks our plans.
The physicist does all the quality assurance and checks on that plan, and also does the checks on the machines to make sure they're calibrated correctly to deliver very accurate radiation. There are different kinds of radiation that are used to treat GI tumors. You have 3D conformal radiation therapy, where we aim X-ray beams at the patient and we actually physically shape those beams to protect the normal tissue and target the tumors. Another type of radiation therapy is IMRT, which is known as intensity modulated radiation therapy. And the computer program runs models where they tell the machine to block and open the beam as it goes around the patient to create that plan. The radiation oncologist will determine what's the best treatment for your particular cancer.
Much better. I am now in radiation therapy, and today marks the halfway mark, which is a wonderful thing.
You can just put your bag right there.
As a radiation therapist, we are the ones that actually give you your treatment that the doctor has prescribed.
I'm gonna move you, don't move, okay? Just let me move you.
When a patient comes in the room and they're on our treatment table, we use marks that we put on the patient, and we have laser lights that come off of our walls and our machine to make sure that the patient is in the same exact position every day. It is very important for the patient to be comfortable and relax. Every effort is used to maintain modesty for our patients.
Prior to you receiving the radiation treatment every day, an image is taken and compared to the initial imaging we took at your simulation. We then look to see if you have to be moved, and we make the adjustments prior to your treatment. This is known as image-guided radiation therapy, or IGRT.
When the patient is properly aligned on our treatment table, the therapist will leave the room.
Okay, here we go, everything's ready.
We have video and audio connection with the patient at all times, and we treat the patient from outside of the room. During the actual radiation treatment, the patient can expect to hear some noises coming from the machine. The machine might rotate around them. They're not going to feel anything.
Radiation has been easier than I thought it would be. In fact, if I could use the expression a piece of cake, it really is.
Patients should expect to see their radiation oncologist once a week during their treatment to check in on them and ensure that their side effects are being well managed.
A small number of lower GI patients might require a colostomy bag. A colostomy bag is a process where a surgeon connects the other end of the large intestine to the abdominal wall to create a stoma and connect a bag to it to collect feces. The colostomy bag is often temporary.
Almost 2 weeks down.
I'm currently on my 8th treatment out of 28, and I'm doing great.
Oh.
I hope that the radiation shrinks the tumor small enough for the surgery to be an easy surgery and be able to recover and get back to my daily life.
The most common side effects of radiation therapy for lower GI cancers may include fatigue, urinary frequency, diarrhea, skin reaction, difficulty holding both urine or bowel movements when you have the urge to go, and gas and bloating. Because for anal cancer patients, radiation therapy is the main form of treatment, we have to give higher doses of radiation therapy to get rid of the tumor. Because of this, oftentimes the side effects may be more severe than patients who are being treated for rectal cancers prior to their surgery with lower doses.
Some days are good, some days are bad. My side effects are the fatigue. I'm really tired, and the bowel movements, they're intense.
Really simple foods like rice and scrambled eggs or...
There have been some side effects, and actually the biggest one is diarrhea. And you just have to drink a lot of water.
The side effects of radiation therapy can be managed through medication or changes to the radiation plan when you meet with your radiation provider weekly. Every patient responds to radiation differently, and so some patients may experience other side effects, and it's best to talk to your radiation oncologist.
Most patients are able to drive when they are on radiation therapy. In fact, a lot of them can still go to work. But we advise patients to listen to their bodies and plan rest periods. We highly recommend our patients of childbearing age to talk to the radiation oncologist or medical oncologist to talk about fertility and get referred to fertility clinics for egg preservation or sperm preservation.
Radiation therapy is an important tool in treating lower GI cancers because it can shrink the tumors, get rid of microscopic disease, and in some cases eliminate the cancer completely.
I feel empowered by coming every day, and it's only for the good.
As a patient, you will not go through this alone. You have a team of experts behind you who can help you, guide you, and educate you.
I want those years. And if I gotta go through chemo and radiation, I'm going. I'm fighting, and I'm going to win.